Hello from Texas Healthcare Trustees again. My name is Amy Eskew, President and CEO of THT, and I'm happy to be joined once again by Cesar Lopez, Associate General Counsel of the Texas Hospital Association. Just a reminder, this is our series of bite-sized education to keep our members and hospital board members throughout Texas updated on the happenings in the 88th Texas Legislative Update. So, Cesar, let's go ahead and jump in on some of the key takeaways and happenings this session. I know you and I spoke last week, and last Thursday was an important deadline, not just for hospital bills that we've been monitoring, but overall in the legislative session. So can you talk a little bit about Thursday?
Yeah, so glad to be here with everybody. Hope that these videos are useful to you all. Again, if you guys do have any questions, please continue to reach out and ask those. We're happy to help you any way we can. So today, as we record this, it's Monday, May the 15th. This past Thursday, May the 11th, was a pretty big deadline at the Capitol. Without getting into all the super technicalities and the nuance there, basically, if bills didn't get passed, I believe it's second reading out of the House by midnight on Thursday. So again, this was Thursday, May the 11th, 2023. They were effectively dead on the House side. So the way that our Capitol works is most of the bills, the bulk of the bills. So if you take all the bills that are filed in any given legislative session, so the 7 to 8 to 9,000, whatever that total number is, the vast majority of those bills are going to be House bills as opposed to Senate bills. There's a lot more folks in the House of Representatives than there are in the Senate, so it kind of makes sense. So most of the bills are House bills being pushed over to the Senate as opposed to Senate bills being pushed over to the House. Now remember, a bill has to go through both sides of the Capitol, the House and the Senate, to make it kind of all the way through, come through 60, pass through the Capitol, and then go to the governor's office for signature. So as we've talked about this year and in prior sessions, it's very, very, very difficult for a bill to make it all the way to the finish line because you have to go through all those procedural hurdles, first in the House if it's a House bill, then in the Senate, or first in the Senate if it's a Senate bill, then in the House. So going back to the last week, Thursday at midnight was that deadline for a lot of those bills to get out of the House and over to the Senate. Otherwise, they were, like I said, effectively dead. So that's exactly what happened. Everyone sort of tunes in, stays up to midnight on Thursday to kind of see where the sort of final line is drawn, so to speak. There's literally an agenda of 20, 30, 40 page document, whatever it is, with all the bills that are supposed to be considered that day. And at some point you draw a line under the last bill that was heard at midnight, and everything below that is essentially done for, at least in the formal bill sense. There are what we like to call zombie bills or zombie issues that tend to pop up a lot of times, or I shouldn't say a lot of times, sometimes. Some of those bills, the language in those bills will be amended onto a bill that actually is moving or has an ability to make it to the finish line. So if a representative or even a senator really wanted to get something to the governor, they could take one of those dead bills, take the language from it and attach it or try to attach it to another bill. And so now is where you're starting to see that sort of gamesmanship, that sort of behind the scenes maneuvering, folks that are very skilled and knowledgeable at how to do these sorts of things on the Senate, on the House floor, will actually go out and start to do that, those kinds of amendments and add-ons and tack-ons and that sort of thing. So, but again, today's Monday, May the 15th. We've got about 14 or 15 days before the official end of the 2023 legislative session. As of this morning, we are starting to hear some pretty significant rumblings about a special session. Not really anything related to healthcare. I think the governor is still not happy with where the proposed law is, or the proposed legislation is on school vouchers. Again, that's a bigger political issue than what we're dealing with here at THA. But it may be enough for the governor to call folks into a special session after the end of the regular session on May 29th. Again, we've discussed this in the past, but the governor gets to decide what is on the agenda for that special session. So it could be just school vouchers if that's his issue. It could be that plus 5, 10, 15, 20 other particular issues that the governor would like to see dealt with during that 30-day special session. And remember, only the governor can call those special sessions. Only the governor can set the agenda. and he can call any number of special sessions up to 30 days at a time. So as we saw 2 years ago, they went back to back to back to back for about 90 days, but that was technically 3 special sessions back to back to back. So he can do less than 30 days, he can't do more than 30 days, but he can do consecutive up to 30 days for as long as they like.
Great, thank you, Caesar. And 2 quick questions I was curious about as you were going over that. Number 1, related to the home stretch that we're in right now, and those zombie amendments or zombie bills that you had talked about, are people or the legislators able to amend any bill with maybe a key issue? So say some of the healthcare bills that were recently killed, can they tack that on to just any bill that is currently active, or does it have to be somehow related to that same topic?
So there has to be, the amendment has to be germane to the bill. And that's, we do things a little differently here in Texas than they do maybe at the federal level. The federal level, I think, again, I don't do a lot of stuff on the federal level, but you could just kind of tack on a bill to any other bill, in theory. In Texas, it has to be germane, it has to be related. The subject matter of the amendment has to relate to the subject matter of the original bill. So what happened, or what's been happening the last couple of weeks, is when some of these bills come up on the House floor, the Senate floor, there'll be a point of order call, which is basically a formal objection saying, you know, there's no relation, it's not germane. And a lot of times that's successful. We'll talk about a bill in these slides here in a minute where that actually worked. So technically, you do have to have that connection between the proposed amendment, the proposed changes, and the original as filed bill. Now, that's not to say that there aren't other ways to get around that. Again, there's a lot of folks that are very good at sort of gamesmanship on the floor and that know how to kind of work the loopholes and that sort of thing. So there are, in theory, ways to get around that as well. So it's everyone at THA, you know, keeping an eye on these, all of our member hospitals that have government relations staff or folks that are paying attention to this, just really keeping an eye on everything that could potentially matter and trying to figure out, hey, did something happen to that bill? Did it get amended? Did something bad happen to it? Was something bad tacked on or whatever it may be? So we really are, it's all hands on deck, and we really are paying attention to everything for, you know, now and for the next 2 weeks or so.
And then similarly with the special session, remind me, I'm getting a little bit of flashbacks from that repeat special session series we had last go around. Whenever Governor Abbott sets his agenda and has his specified topics that he wants addressed by the legislature, are legislators still able to propose bills that may not be directly related to Governor Abbott's agenda?
Again, I think there has to be they have to fall under that umbrella. I think it's a pretty broad umbrella. You know, 2 years ago, we did have, like I said, there's 3 back-to-back-to-back special sessions. They weren't really, the issues discussed during those special sessions really weren't too big of a concern to us here at DHA, not like prior special sessions, I should say. 2017 was a particularly problematic special session for us. And I think we've probably had a special session now every single session since then. But yeah, in a lot of ways, a special session could be easier if we know, you know, the governor's agenda isn't going to affect us or really concern us. We'll obviously still pay attention to make sure nothing bad happens, but it's usually a lot easier because we know the small universe of issues that are going to be brought up during the special session.
Mm-hmm. Okay. Well, thank you for the inside baseball. Let's go ahead and kick it over to the presentation that you built for us. Appreciate this today to go over all the bills THA is still keeping a very close eye on.
So this is just a small sample of the bills that we are still paying attention to or still have concerns over. Of course, you know, as we get to the end of a regular session, we'll have you know, every single day we'll have a much clearer picture of where we're going. Remember that THA is going to put out a lot of information at the end of session. We have an end of session member call. We'll have our inter-session wrap up, which usually goes out a week or 2 after the end of session. So should be out by the 1st or 2nd week of June. And then we have our health law manual, which should be ready to go and out and published by the end of summer. So August, September timeframe. And then, as always, if any of the members want to have a phone call or have us come out and visit or whatever, I personally will make myself available as much as I can to go out and visit with folks and do this presentation, but we'll be at conference, we'll be talking about this sort of stuff from now until next 6 to 12 months or so, and just kind of making sure that all the members know what's out there, what they need to know about, how to prepare for it, or how to implement these new regulations. So just running through about 10 to 12 bills that I pulled for today's discussion. Some of these are repeats from prior months of the session, but again, just wanted to highlight, hey, these bills are still out there, they're still moving, or they're not for whatever reason. So HB 12 is a bill that we've been talking about for some time now. This is that our annual push to extend postpartum coverage to 12 months. This bill actually will be heard tomorrow, May 16th in the Senate. So this is again a House bill that made it through the House, is now at the Senate, has to go through that same process, the hearing, Senate floor, and then goes back to the House. And if it's clean, meaning that there aren't any amendments, it goes to the governor's desk for signature. So it is more than 50% of the way there. And it will be heard tomorrow, May 16th, in Senate Health and Human Services, which is a good sign because there are only so many days left in this regular session for hearings. So if it would be very easy for somebody to not have this bill heard if they really wanted to bottle up and kill it somehow, but it is going to be heard tomorrow. So looks like it has some momentum behind it, and hopefully this is one that will make it all the way to the finish line. HB 49, this is another bill that we at THA have been working on for a couple of sessions now. I think we've talked about this one in prior months as well. This is a pretty straightforward bill that would increase transparency related to state investigations of hospitals. Sounds like it's a big deal. It really isn't. The way that the current statute has been interpreted creates a lot of opaqueness around these investigations, and it kind of looks like hospitals and HHSC are trying to hide things, which we really aren't. So this basically shines some light on these investigations, put some very basic information out there for public consumption after an investigation. It does protect, anything that would be sort of covered by HIPAA or, gets at some of those privacy concerns. But this is a bill that thankfully made it all the way through the House, all the way through the Senate. It's at the governor's office waiting for a signature. So this is one of those sort of success stories in that this is a bill that has made it to the finish line, barring the governor's veto, which he always could do, of course. HB 240 is another bill that we've been talking about for some time. This is a workplace violence bill. Another bill, again, that we're happy to report has made it all the way through the House and the Senate, is over at the governor's office waiting for him to sign. HB 1236 hasn't quite made it there, but it is moving along nicely. This one was actually heard in the Senate last week on Wednesday. I testified on this one again on the Senate side. I did testify on this one on the House side as well. This is one that would just basically codify that prudent layperson standard for emergency care ER visits. Basically, a patient goes into the ER. We talked about this, I think, a month or two ago, but it goes into the ER, thinks about a heart attack. It turns out to be something like indigestion, but you still want the ER staff to assume the worst case scenario and then work backwards. And you want to be able to have that staff paid for all the work and the tests they did, thinking it might be a heart attack or whatever, and working their way backwards. So the insurance plans do have some concerns with this bill. They are trying to amend it to allow some ability for them to conduct a review for fraud and abuse and that sort of thing. We don't think that's necessary. So we're kind of having these behind the scenes debates on that. But again, this is a pretty straightforward bill that we think should make it to the finish line, and it is continuing to move forward. HB 1890, another bill that we've talked about. This is the hospital at home bill. So this is that flexibility that came out of the COVID-19 pandemic that allowed hospitals to kick off and set up those hospital at home programs. With the federal public health emergency, which ended last week, FYI, if you guys haven't been paying attention, we wanted to make sure that we figured out how to keep some of those options available for Texas hospitals even after the expiration of that federal PHE. So this was one of the big ones that hospitals came back and said, hey, we took advantage of this, we used it, it works great, we want to keep it available. How can we make that work? So we at the state level worked on this legislation. It continues to move forward with some momentum. And all this does is basically codify that ability for the hospitals, so the state level and the federal level working together to make sure that that hospital at home program can continue for those that choose to utilize it. SB 490, this is an offshoot of, and I forget the House bill number, but this was a bill introduced that would require every hospital to provide an itemized bill to every single patient after services are provided. That would be hugely problematic for hospitals. It's an issue that we've been fighting back against for several sessions now. I basically think about the size that a bill would be. I mean, the sheer number of individual sheets of paper that would compose a bill, let's say for a 8 to 10 day hospital stay, if you had to go in and itemize every single thing that was provided to that patient and provide that bill to them at the end of their stay. The idea behind it, I guess, makes sense. You want a patient to be informed as to what they're receiving, what they're paying for while they're at the hospital. We currently do have a requirement to provide an itemized bill upon request, but this would make it automatic. So patient comes in the hospital, at the end of the stay, here's your itemized bill. It could be anywhere from 1 to 1,000 plus pages, whatever it ends up being. So we've been trying to work this bill and figure out a way to make it manageable. We've proposed everything from electronic versions of an itemized bill, things like that. And so we think that where we're going to wind up is that these provisions would apply, but the bill would be amended to only kick in when we're going to formal collection efforts. So we're actually, the hospital is actually going and starting debt collection or kicking it over to a third party to engage in that debt collection practice. At that point, you would have to provide the full itemized bill. Now, that's not set in stone yet, but that's where we think we're going. Again, we'll see where we wind up in about 14 days, but that's our hope, is that we can lessen the burden on hospitals in that provision of those bills. A few more here, and I'll kind of go through them pretty quickly. HB 3162, again, another bill that we've been talking about for a number of sessions now, several months now this session. This is our big end of life bill. I'm happy to report that all the stakeholders, I think I think one stakeholder didn't actually sign, but went in and signed a very formal legal 2 to 3 page document, basically saying we, the stakeholders, the 10 or 12 of us, THA included, TMA, several others, agree that this is a good bill. We're behind this bill. We don't want this bill to be modified or amended in any way. We just want it to pass through both the House and the Senate. So remember, this started in the House. We all signed that agreement about 10 days ago. It actually sailed through the House last week. It's now at the Senate. It's going to be heard tomorrow, May 16th in the Senate. Assuming that agreement holds and all the senators abide by that agreement. Again, they're not obligated to, but assuming they do, I expect the same thing on the Senate side and that bill to go through as we call clean, with no amendments, no modifications, and probably make it to the finish line. Now, again, that's not set in stone either. There could be something that happens between now and the end of session. But again, we did sign that agreement indicating that we're not going to make any attempt to modify the bill. Now, this is a 40-page bill, so there's a lot in there. If this does pass and is signed by the governor, this is one that we will definitely have to engage in some education and training on. So keep an eye out for that. The LPPF bills, this is the local Provider Participation Fund bill. Sorry, I always forget what the acronym is, but this is where I could potentially get us in a little bit of trouble because I'm a little over my skis on these issues. But this is basically the mechanism by which Texas hospitals can pool resources together to draw down additional federal funding for healthcare services provided in their area. Again, there's a much more technical explanation for that I'm happy to provide if anybody does need it, but just remember that this is basically a way for hospitals, usually at the county level, to team up and create a mechanism to pull down additional federal funds. These have been in existence probably 4 or 5 sessions now. They generally exist at the local, let's say, county level. I don't know of any that are beyond county level, but there may be 1 or 2. There has been discussion about making a statewide option for hospitals to go ahead and engage in these additional drawdowns. But again, these are mostly at the county level, the local level. And so there are a number of bills out there with counties that are either renewing their LPPFs or trying to create a new LPPF and obtain that additional funding. And so they're all still alive. None of them have been killed that we know of. And they continue to move forward And so hopefully all of those are going to make it all the way to the finish line. So real quickly, just a couple more. SB 840, another workplace violence bill. This would create a third-degree felony for the assault of a hospital worker. That one's moving along. HB 633, this is a bill I mentioned earlier that was actually successfully defeated on a point of order relating to that germaneness, that issue that we talked about a few minutes ago. This was a bill that we were very much concerned about and would have essentially endorsed government rate setting for insurance providers and hospitals and healthcare providers. So it was a very, very, very bad bill. It basically would have created an incentive for folks that could afford to pay out of pocket to forego insurance, because if you came in a hospital and said, hey, I just want to pay the cash pay rate, you would automatically under this bill get the lowest negotiated rate as that cash pay rate. So again, a lot more behind this. It's a much more complex bill than I can set out in a couple of sentences, but the takeaway is that this bill was successfully defeated on a point of order objection on the House floor. So this is one of those potential zombie bills, because if the bill author really wants to see it pass, they'll be able to pull it out and try to tack it on to another bill. SB 1534, another one that we've talked about for a couple of months now, physician non-competes. This one kind of slowed down a bit, but it's still very much alive. We've been trying to modify some of that language in the bill, specifically concerning to the scope of that radius. So we're actually pushing for a 15-mile radius now. But again, that bill is still out there. If this bill does pass, it would effectively limit the use of physician non-competes in the state of Texas. Now, this is only limited to physicians, so keep an eye out for that one as well. HB 711, this is another beast of a bill that we're very much concerned about, that continues to sort of linger out there. We've been able to kind of slow it down a bit, but it's still very much alive. And this is another one dealing with that, insurance rate setting, the way that hospitals can engage with insurance companies and how they're reimbursed and things like that. So this really does a lot at trying to, what the author considers, tamp down what the author considers to be hospital gouging, hospitals going out and really taking advantage of their power in the marketplace and the ability to kind of steer things in their direction. So another one that, if it makes it to the finish line, is going to be hugely problematic, but we continue to work on that one. So Amy, that's all I have as far as bills, but yeah, let me know if you have any questions or anything you want to specifically talk about.
Sure, appreciate that update. I guess
Yeah.
my last question for today's session is, what process-wise can we expect for the last 2 weeks or so of session?
So again, hearings are continuing with just a smaller, universe of bills that are out there, but there are still going to be hearings on the House and the Senate side. A lot of the committees that have a lot of bills to work through will now shift to meeting multiple times a week. So instead of just once a week, they'll go, Tuesday, Thursday, sometimes on the weekends. The Capitol didn't meet over Mother's Day weekend, which was this past weekend, but they are going to meet probably the next 2 weekends through the end of the regular session. But this is really where things get very wonky, and folks really just have to sort of stay glued to the hearing, stay glued to the Senate and the House floor, keep pulling up bills as they sort of pop up and are populated on the sort of the online data banks, and really read through them and just make sure that something wasn't added on or something wasn't pulled out or whatever. So it's just a lot of that. I mean, it's going to be hearings, it's going to be floor debates. There is going to be situations where a bill that comes from the House or the Senate and goes to the other side and is modified. There has to be some concurrence between the House and the Senate on bills that are modified once they leave the original side of the Capitol. And so a lot of times for some of these higher profile, higher consequence bills, we're going to be monitoring those, what they call the conferences. They're going to send, the House will send some folks, the Senate will send some folks, they'll go in a room and they'll meet and they'll try to work on sort of a compromise bill between the two versions. And so if it's a bill that really matters to us, we will really, really, really pay attention to that. Try to get folks in the room that we think will be helpful to our cause and that sort of thing. So it's kind of like a mediation between the two sides. But yeah, it gets very technical, very wonky. In a lot of ways, a lot more exciting because it's sort of that sort of backroom maneuvering and that sort of thing. But yeah, that's kind of what we're in for these next 2 weeks. It's going to be probably 14 straight days of just something. So we're almost at the finish line for the regular session. Like I said, and potentially a special. So we may be back in a month or two, continuing this. But it's, there is a light at the end of the tunnel.
Yeah, well, appreciate again you being here today because I know there's no shortage of work for you. As Caesar had mentioned, check out tha.org for lots of information on what's going on in the legislature, especially the CAP recap. It's a great newsletter, an article series that's published on THA's website. Also check tht.org for more information and for our previous sessions. And I'll do a quick plug for Caesar as well. We have our healthcare governance conference coming up July 20th through the 22nd, where we will have our annual legislative update from Jennifer Banda, Senior Vice President of Public Policy and Advocacy for THA. And also Caesar is doing his reoccurring session as well on compliance and rule updates. So I encourage you all to check that out at tht.org/HGC. And Caesar, we will check back with you in June. It'll either be a session recap and or a special session preview. So until then, appreciate you joining us today. Thank you.
Yeah, anytime. Thanks, y'all.